All right, so today we are going to talk about menopause, that change of life that I think us as women are like, is it coming? Is it going to happen to me too? Eventually, if we live long enough, yes. But it's something that we don't have to suffer through, especially when it comes to pelvic health. So something that a lot of people don't realize is that our bodies may have changed, especially if you've had kiddos, and maybe you didn't have symptoms that with things down here, but then you go through menopause and then all of a sudden you're having symptoms. We often don't think, oh, maybe it's due to some other things before. We think, oh, it's just that season and now we get to suffer with all these things. False. So highly recommend getting a full eval so we see what's going on with you. But oftentimes I'm just going to go through a couple of things that we see most commonly. One is prolapse. So prolapse is when the organs start to fall through the canals here. So it's usually bladder, uterus, etc. And so it's due to a number of factors, but basically the organs no longer have the support. This can show up as like heaviness in the lower abdomen. It can show up with episodes of incontinence, things like that, pain with sex for sure. But what happens with menopause is usually the ligaments become more lax, right? Our hormones change. But oftentimes before that, the muscle tone changed and we didn't realize it. We didn't quite have symptoms yet. So we get in there, and while we can't do a lot necessarily about the ligaments exactly, we can definitely change the muscles. And then sometimes that will help to correct for the strain that's on those ligaments, because the muscles will basically get back to work and help hold everything up again. So we see quite a few people, we are able to fully reverse those prolapses. And then sometimes if we do feel that it's that it's gone too far, we're happy to help make a recommendation too. But that's usually pretty rare if you're coming in early menopause. And then the other thing we see often is like vaginal dryness. Women will complain that it just feels dry down there. It just doesn't feel like, or they're lacking intimacy. They just don't want to do it anymore. And that's something that, again, a lot of times the muscles and things, or even though the hormones have changed, a lot of this is shut down in here. So we help bring that back to life, and oftentimes that can help make the adjustments so that people will have more comfort in those areas. And then we can also help with other recommendations if necessary to make sure that, again, you're fully enjoying those areas and or interested in the first place.